Working, hopefully. Great. I appreciate the opportunity to be here. Thank you very much to Wellcom for inviting me and allowing Interactive to be a sponsor of this event. Dan did a ton of my work already for my presentation. So, my goal of today is not to be an advertisement about interactive health at all, but more to talk about how a lot of what Dan set up the conversation around a much more holistic view of health and what impacts health and healthcare outcomes, how employers can maybe take that into action. This is probably going to be the most relevant to employers that have multiple work locations that are just dispersed around the country. I do want to out the fact that I live in Ohio, so I live right in the cluster of like the worst states, it sounds like, for well-being. I found that interesting. I think it's a nice place. I don't know. I gotta see what's data. But anyways, I've been in the employee wellness space. I still call it wellness. I'm sorry. Sometimes I revert to 20 years ago and call it health management for about 20 years, and have been with 3 of the larger interactive health, being the third, large vendors in the space. I've worked with hundreds and hundreds of employers across the country, from the very largest private employer in the United States down to employers with 25 to 50 employees. And I've had a real opportunity to see the progression of employee health and employee wellness strategies, but also get a tremendous view into what works and what companies have done to make things work, and as Dan started out, maybe why wellness isn't working. And so I think today what I'd like to do is take this down to a little bit more of a local level. I'd like to focus the conversation mostly on how this expanded definition of employee health has impacted what you all do and we do for employees, with some tangible recommendations of what we can do to improve the outcomes of these programs. So quick agenda, I want to talk about what social determinants of health are, how they affect employee populations, and give some real world examples of regional disparities. Dan did it at the state level, and I want to take it down to a much more narrow level of actual communities and talk about, because that's where you have employees, right? You have employees in a community, city, or town. So I'm a stickler for semantics, and one of the things that's frustrated me the most about health and healthcare in the United States is that we use the words health and medicine and interchangeably. And I've come to believe and understand that while they're obviously highly related to each other, they're actually very different. In fact, it sort of drives me crazy that we call health insurance. It's actually medical insurance. It's medical access insurance. And I think in a lot of ways it's reduced the level of personal responsibility that each of us have around health. For most of us, most of the time, they're not the same thing, right? I haven't been to the doctor for a year. I should go pretty soon probably, but I haven't been to the doctor for a year. I'm about to turn 50, so there's some things that I'm probably avoiding that are unpleasant. But anyways, so I can't really say I've made a true health or medical care decision in quite a while, but every day, I make tons of health decisions. So, Joe, who, if you don't know Joe lives here, just when we pulled it this morning, hey, do you want to take the elevator or stairs? Like that's a really small health decision, right? So collectively, we've made already hundreds of them today. But we talk about them interchangeably, and for the purposes of this talk, I want to, if I use them interchangeably, I apologize, but health and medicine are different. And we're going to talk about how they both, impact strategies that employers obviously are trying to achieve. Exactly what Dan said earlier today is that, employers over the last 20, 30 years have sought to impact healthcare costs by focusing on medical claims and health risk data, right? HRAs and now more increasingly, devices and the aggregation of data about populations. And we use that primarily because we're historically trying to impact the healthcare cost spend, right? From populations or employees. But for the most part, we've ignored the emotional, social, community aspects of health, right? When I first got into employee health management 20 years ago, mental health was a taboo issue in the workplace. We didn't talk about it. We had this thing called the EAP that people could call, but we didn't do anything proactive. And I remember sitting with employers 15, 20 years ago as their drug spend was starting to grow as a percentage of their overall spend. But it was pretty traditional things. It was PPI drugs for gastrointestinal, it was cholesterol, maybe hypertension, and diabetes drugs, right? That's the most commonly prescribed. And today, when you go into an employer and you would look at what are your top 10 drugs, you're probably going to see 30 to 40% of those top 10 be some form of mental health drug, right? And that's a new phenomenon. So that dynamic has changed what employers think about and what has become, normative in the workplace to address from a health perspective and a medicine perspective, but also it's just our changing society, and also just the technology that's available to us. So finally, this is the third core assumption for this presentation. Employers today are actually trying to seek the return on health through creating cultures of health. And I guess what I want to focus on today is that to really impact culture, you have to take into account the environment that your employees live in and the disparate environment. So, thankfully Dan doesn't employ me because I live in Ohio, and I'd probably be like a really expensive employee versus somebody who lives in another state. We think of the United States as a cohesive group, and as Dan showed, it's not. But I also, what I want to show is that down at the local level, it's even not. Where I live in Dayton, Ohio, is very different than maybe 150 miles away, as far as access to care, health norms, profiles of populations from a risk and behavior perspective, and other, socioeconomic issues. And so that's what we're going to talk about. So, has anybody heard this headline? It's been bannered around pretty frequently this year that your zip code is more important to your health than your genetic code, right? A lot of this came out, if you remember, Amazon, JP Morgan, and Berkshire Hathaway that started a joint venture. They hired a physician surgeon from Harvard who'd done a ton of work, and one of his most substantial pieces of work years ago was in Texas. And they did a profile of a community that consumes the most healthcare, what we traditionally think of healthcare provider, medical care in the country. And they have really, really poor health outcomes, right? So it's an interesting dynamic. When we talk about social determinants, in fact, all the work that I had done around social determinants before coming to Interactive Health and being this year was in the context of my previous job working for a venture capital firm that was trying to fund disruptive, digital health companies. And social determinants was always in the context of what we think of as disadvantaged populations, poor populations often, and the health disparities that those things create. I think that's probably the wrong context to think about social determinants. We all, at every economic level, every location, are impacted by social determinants of health, and we'll kind of show this later. But this is the definition below of what the World Health Organization means by social determinants. It's our life context. I listened to a podcast recently that was about this topic, and they called it "Life Sucks" disease, right? So this, that all of us have all these pressures. It's work pressures, it's life pressures, it's kid, financial, all these things, right? That create and impact health habits And where we live can often exacerbate those, and we'll get into that here in a minute. So I stole this slide from a conference I went to a couple of weeks ago where they were talking about diabetes care related to social determinants. And I'm not going to spend a ton of time on it, but Dan talked a lot about kind of job, right, the workplace and how that creates and impacts well-being. One of the things that I've been spending a lot of time on is this idea of job stress, and I recently came across some information about a related topic called job strain, which is a little bit different, which implies that a partner in a law firm, let's say, right, really, really stressful job, right, really high expectations, super high income, but really high stress. Yet they have relatively high control, right? If they decide that they're gonna, take an hour off of work to go to a doctor's office for a visit, they can do that and they can catch up it later and do the work at home later, right? So they have a high degree of job control. Where another job that we may think of as low stress compared to that job, maybe is with the job function, but they have very low control. They have to be at work at a certain time. They have no ability to adapt their schedule around their life, right? Jared, who's with us at Interactive Health, goes out on behalf of our customers and goes all the way around the country and meets with employee populations of our customers to promote our program. And one of his peers a couple weeks ago was at a work location, and she had to show up at midnight and was there till 2:30 in the morning to meet with employees, because that's the shift they work. If you think about that, those people probably have very little job control, right? Role control. And you think about the impact that may have on their well-being. Income and wealth, I thought what Dan talked about, so I'm not going to spend a whole lot of time there, but it is get down to this idea of how socioeconomic pressures and financial pressures impact our well-being. I will tell you that I woke up about 6 months ago and realized my daughter, one of my three kids, unfortunately, I love my children, but three is scaring me now, is going to college. I'm going to go to college in 2 years. And it really, I woke up and it has created a tremendous amount of stress for me because I've saved, but I probably didn't save enough, right? And so now we've gone into this like batten down the hatches mode at home because we've got this huge expense coming up and it's created a lot of stress and changed our life. Neighborhood and family, Dan talked a lot about this and this will be covered later, but I think one of the most fundamental problems or mistakes that employers have made in their employee wellness programs is they focus on the employees instead of the covered lives, right? Almost every employer I go into, employees represent less than half of their covered lives. Yet their wellness program is almost always through the lens of the employee. I think the challenge is getting into the home is really, really hard. But I can tell you that, my wife doesn't work. I'm the sole breadwinner, which is again why I'm probably so stressed out about college. But I almost make zero household decisions. My wife, I make no healthcare decisions really. So, I don't do the shopping. I don't decide where, we go out to dinner often. And so all these health decisions are really being made by somebody else in my household. And I think as employers start to think about how do you actually impact and influence individuals, you have to take into context this family dynamic. And then finally, obviously, social determinants are driven by education and other aspects of literacy, and Dan did a good job of covering that. So I don't know if you've ever seen an infographic like this over here, but if you Google something like what makes us healthy, you'll see these infographics that basically show that, health behaviors, and when we say environment, what we're really talking about is life context or community, by far make up the biggest aspect of what makes you healthy. Genetic code, maybe relatively small, and then access to care is actually really small. If you Google the inverse of that, said what kills us, you'll get a whole bunch of other infographics and data, but they don't change all that much. So the idea is that for most of us, most of the time, throughout our life, now I'm not saying everybody, but for most of us, most of the time, your environment or your life context and your behaviors are what drive your health status. and in the long run, your need for healthcare services or medical care services. And I think what I've come to find, and I want to be really clear that I've been working on this project in interactive health with our chief science officer, who is a doctorate from Harvard in behavioral epidemiology. So if you don't agree with anything up here, you can give her, argue with her about some of it. Lifestyle behavior issues in community or life context are intrinsically linked. And we'll talk about how in specific communities, life context can either be a positive factor around health behaviors or a negative factor. And how employers can use this type of profiling of communities to understand what the unique needs are as they try to build a holistic wellness strategy for a large or even medium-sized corporation. So as it says here, the second data point, I think I actually wrote it wrong. What I was trying to get across is that employees spend most of their time not in your workplace, right? So you should take time to understand the community or the environment where your workplaces are. Because, they might be at work 40 to 50 hours a week, but, most of us are outside of work, hopefully much more than that. Most employers have more than one physical location. What I tend to find is that they have a headquarters in a large city like Omaha, right? Then they have locations across the country that often are in much smaller communities. And the HR and benefits team, the wellness team, they often know their location really, really well, right? And they maybe every once in a while get out to the hinterlands of Kentucky and Ohio and these other places where they might have distribution or manufacturing facilities or call centers. But they don't know those locations nearly as well. They tend to design wellness programs as if every work location has the same needs and dynamics. And then finally, we talked about this earlier, that we're focused on creating these cultures of health. But if we don't understand and take into account these life context issues that surround where employees work and live, we're probably not driving meaningful engagement for everybody, right? So this definition of engagement may need to change across a corporation to meet the needs of those communities and the people in those communities. I used to, I'm not going to drop any corporate names, but I used to work with a very large company that was headquartered in a wealthy suburb of a major city. And they had 50,000 employees, and about 6 of them were in the headquarters and the rest were spread out. And many of those were in large distribution and call center environments in relatively small towns across the United States. But in their corporate headquarters, they had this beautiful on-site fitness center, right? They had a beautiful on-site medical center. And when I asked them, what they were, why they had these things, and it was they talked about part of their healthcare strategy, their cost containment strategy, and get employees healthy. But this was an environment where everybody that works at headquarters was relatively high income in a very wealthy environment, the surrounding environment. With really high levels of job control, white collar, really high levels of job control. So they weren't solving an access issue at the fitness center, nor were they solving it at the on-site medical clinic. They're really creating a convenience benefit, right? But then if you go out and visit their distribution centers, that would be in places like Oklahoma or rural parts of Ohio or other places, these were communities that had real healthcare access issues and had employees with really low job control where they were avoiding care because they could not take time off and do their work later on at home at night, right? And so when you start thinking about where you should be deploying these strategies, they may be the exact opposite of what many large employers traditionally have done. But understanding the communities at a pretty foundational level can be helpful to deploy those. So Dan already talked about this, but again, when I first got into this industry, all we really cared about was this. Know your numbers, take me to array. How are your health behaviors impacting your physical manifestation of health? We have moved into this mental, and my circle was too small, my font was too big for emotional and social, but we've now taken into account all 3 of these, I think, in most employers. What I'm advocating is you have to take this bigger circle at a local level and have to understand the environment that surrounds these three things. Every place I have, populations of employees. I'm not talking about the, lone salesperson that lives in their home, works out of their home and, is on their own, but where you have large employee populations, I think if you truly want to drive employee engagement, you have to understand this from an environment perspective. So, I do not have a map of the whole country, and I'm not going to compare states, but I do want to give real-world examples of communities that we've done work in with our customers that are places where employers have, they're maybe the dominant employer in town, or they're one of the dominant employers in town, but it's far geographically away from where the company is headquartered. And represent very different health dynamics in these communities. And so, let's start here. So, what I've done is I've taken 4 communities across the country. I didn't need for all of them to be in the Bible Belt and Midwest, but this is where we have most of our customers, so I guess I did it. One of the things we do is we look at hundreds of data points about communities. And they're things that employers often know a little bit about, but not a lot. So for example, you know what you pay your employees, but you may not know what their household income is. And you may not know what that household income is in relation to the cost of living in that community. And what that, what Dan talked about at an individual level earlier, which is how well does a person do with managing their finances and living within their means. But you can often look at a community and profile this data and understand, is this a community problem? Is this going to be something that maybe it's not a problem for my employees, but it's a problem for family members of the employee, right? Or their neighbor. Is this creating pressure on my employees? And that this is something I need to take into consideration. I don't have any of it here, but we can profile communities and understand total breakdown in income and housing value and how those two relate and other spending patterns. What I think is really interesting is that if you look at this second data point around the community norm of how many people are avoiding care, and some of this is coming from self-reported data, county level data, census data, but you'll often see in certain communities that there's a high avoidance of care. And so you can all imagine what the downstream implications and unintended consequences of those things are. As you can see in this community here in Missouri, it coincides pretty heavily with low education attainment, right? We've got almost half the rate of people that have a college degree as the national average, and we've got a higher than average, national average of no high school degree, and you combine that with a fairly high incident of violent crime in the community. And so when you think about these things, you can think about that life context that creates for this community and people that live in that community. One of the things that we track, and this is 3 data points, although we're able to profile many more data points about food deserts and about what percentage of employees live close or have access to stores that sell healthy food, what percentage, when you combine that with car ownership around transportation and derive some statistics. You can often also, in this category, you can link statistics like average commute, because people that tend to commute longer often are going to be using convenience food more frequently for their family than people that have short commutes. One of the things that we found where we had an employer that was in Kentucky, and this is not just this town in Kentucky, but other small towns we've profiled, have an extremely high density of fast food restaurants per capita. And these are often tied to socio-economic issues. There's a supply and demand that, obviously feedback loop that's going on in these communities. But you can think about, and we'll talk about this later, like what do you do about this, but you can think about that if you have a wellness program that is promoting healthy eating, but it isn't promoting it in the context of this reality, both economically and from a supply perspective, you're probably not going to get very far, right? And I can tell you that when we looked at this employer in Murray, Kentucky, also as in Poplar Bluff, but we looked at other communities that they had, that wasn't really a big issue, right? And so trying to do it for everybody probably doesn't make sense. Not doing it is you're gonna miss a real opportunity in this community. Fitness is another big one. There are communities that have poor access to fitness resources. You can also profile communities and neighborhoods to understand, do they have sidewalks? Right? If you're going to start a walking program and a walking contest like Dan talked about, and you're encouraging your employees to go out for a walk, but they don't live in safe neighborhoods, or maybe it's safe from a crime perspective, but it's on they have really low density of sidewalks, that may impact the ability for those people to be successful. What's really interesting is we start profiling communities around access to care. I was talking to Joe on the way in, and we were talking about that I had met with an employer, and we were talking about their really low mental health claims. And we were able to say, yeah, that location really does have really low mental health claims because there's no mental health providers in that community, right? That's maybe not a good thing. They felt at first like, oh, we're doing really well. No, you're not doing very well. This is maybe a really bad thing. And as we heard this morning, and in my previous slides, poor mental health and poor emotional health manifest themselves in physical health and health decisions that are damaging to people and families. So understanding this, you may need to have a very different solution in these communities that you're deploying if you actually want to improve health than you do in where you're headquartered or in other work locations. Recreation facilities is another one. This just gets down to this idea that people have places to go to be active. Lifestyle behavior issues. This Marion, Indiana is by far not the worst I've seen. I've seen communities that have obesity rates in the high 40s and low 50% range. And if you take what Dan said, that means it might actually be even higher than that because people, Greg asked a question about, self-reported data as good as professionally reported data. But if you think about a community where the obesity rate might be in the 40% range, another 35 or 40% may be overweight, that creates a cultural norm in that community, right? And I tend to compare myself to the people around me, the people I see every day. And so I may have a cultural norm of, I'm pretty good. People around me, this is normal. None of these communities are excessive drinking, but I'll tell you, if you run this on any community in Wisconsin, it's off the charts high. They just kind of shrug their shoulders. There's nothing else to do in the winter, Are you from Wisconsin here? No. Yeah, okay. Kind of have the school there. Okay, I knew you had a connection. In places in Wisconsin that we've run this, it can be, this is not just drinking, this is excessive drinking, it can be in the high 20% range, right? So if you think that your employees aren't impacted by that, probably not true. Smoking rates, we tend to think we've gotten smoking, we've stamped out smoking in the workplace, and maybe we have, but if you have employees in some of these communities where you have these really high smoking rates, they're probably being impacted by secondhand smoke, it's a cultural norm in their communities, it's stress from family members and so forth. So, understanding that should dictate the programming that you do in work locations. So this is just an idea, or you can take some of these locations, you draw some inferences, you may want to say, what would we do differently here? So, we may need to, here in Poplar Bluff, focus on financial well-being. We've got people that are avoiding care. We know that there's financial issues and just basic health education because of low literacy and educational attainment. If people are avoiding care, maybe I need to bring physicians and pharmacists into the workplace. If they're avoiding care, they're probably not filling scripts. They may be splitting pills or taking prescriptions every other day, right? So I maybe have to do something different in this location. If they're avoiding care, I may need to have a focus of care navigation here that isn't maybe relevant in other places. Shared decision-making, resources available to people to understand how treatment options align with how they prioritize quality of life and outcomes, second opinion services, you name it. Here in Murray, Kentucky, we have this big problems of low access to fitness resources, high obesity and diabetes, low nutrition combined with mental health. So you would do things differently there. If you were designing a wellness program for your employees and you had a big pocket here in Murray, Kentucky, you should be thinking about doing something different for them than the employees in Chicago, maybe, right? So finally, what are my recommendations? Obviously, I think the whole point of this is take time to understand the local dynamics impacting the broader definition of health, right? So if you have major work locations, understand these dynamics and what you can do about them. Go out and talk to employees, understand what they really need, look at the community, what does community resources have available to them. A good friend of mine who used to work for a company called Barry Waymiller, I don't know if you've ever heard of it. It's a pretty famous company around their culture. But she used to be part of their health management strategy. She literally was telling me a story the other day how they would go into small communities where they were a dominant employer, and they would work with the local restaurants to actually put labels on the restaurants' menus around healthy items as a very wellness program. And they had the ability to do that because they were a large employer, and they would then, through the wellness program and application, promote those menu items as being healthy to their employees as part of the wellness program. So it was good for both parties. And so that's a really tangible example of an employer getting, this is a large employer at many, many work locations, going and getting feet on the street in these communities and driving health management strategy. Second, think much more broadly than just the employee. Think about the family unit. It's the most basic social structure for most of us. And if you want to impact health and wellness, often you need to get the whole family engaged. Years ago, I became involved with an early stage company that was trying to impact childhood obesity, and they decided that because it was so hard getting families one at a time, they were going to go to employers. And they called me and I said, "You guys are crazy. Childhood obesity, seriously?" And they had all these statistics about, well, child, an overweight child or an obese child costs 3 times as much as a normal weight child. Healthcare costs. And I said, yeah, I've got 3 normal weight children, they cost $50 a year. So, 3 times sounds bad, but $150 isn't very much, so who cares? But help them focus on, but wait a second, tell me more about your program. And as they got into it, they talked about how the whole family had to be involved. And the parent had to change the environment for the family, right? Because kids don't go to the store and buy Twinkies, mom or dad does. And so we started measuring in that program, did parents get healthier? Did parents lose weight when their children went through this program? And they did. And now they have a thriving employer business because employers are struggling to get relevant programming into the home and get family activated. So finally, when you look at your healthcare outcomes, and again, I think that through the earlier presentation and this, the definition of health and healthcare is bigger than maybe we thought of years ago. Consider measuring the outcomes for your company in the context of the local health norms. So if I can profile these communities around these health dynamics, how do my employees compare around these behavior issues, lifestyle behavior issues, around these prevalence of disease issues? So that I understand, am I doing better than the community? Are there things that I need to work at a community level if I want to impact my employees? And it's not easy, I get this. Believe me, I know this isn't easy. But I think if we're really going to be focused on employee engagement, we have to think about large employee populations as being really groups of small employee populations that have different needs and different health dynamics surrounding them. So there we go. All right, thank you. I appreciate the opportunity. We have a couple minutes for questions. Yes, sir.
I'm ashamed to admit, of those towns you listed, I actually grew up in one.
Which one? Just out
Mary.
Okay.
Yeah, I haven't lived there in 30 years, but that's
Okay.
where I grew up. Quick question for you. I too face the dilemma of companies contacting me and talking about wellness and programs, and they have 2 or 3 major locations, and they have 20 diverse, smaller locations scattered throughout the country. And I find that their spend is predominantly on the headquarters and maybe their two largest facilities. What recommendations do you have to raise their awareness of the need to terminate their organization with the program?
Yeah, I think, the perspective that we've taken is to be able to go in and sit down with our customers and show them this, but even more data about how these communities are very different, right? And they often have this data that shows their healthcare costs are different, that their health risk data from biometric screening, HRAs, and other things are different. But we help them, understand the disparities that those communities have, and then translate that into how, what does this community need that's different than a community in another state, another location. That's the focus that we've taken. And I think the benefit of that has been that employers are starting, that we're working with around this concept, are starting to think of engagement in a much more local level. And so what is it that engagement means good engagement means in Murray, Kentucky versus Marion, Indiana? And what are the biggest gaps that these communities or the employees in this community are probably struggling with? And then how do I relate that and tie that back to not just your healthcare strategy, but your overall business strategy? Like how do they tie those business metrics that are important to the employer, around human capital management, productivity, presenteeism, and things like that. So, I think getting them to think beyond a corporate culture of health to how local dynamics impact cultures of health versus a culture of health is probably the recommendation I would give. Yes, ma'am.
Where do you get this data for your town?
You buy it, and it's not cheap. A ton of it is available, but it's aggregated through places like Equifax and Experian and TransUnion and vendors that literally are pulling together census level data and county health record data, court data, all kinds of data. In fact, I showed you a small subsection of what's available. But you can, if you wanted to just focus on one aspect of it, it's actually not that hard to find. If you want to do the complete, it is much easier to go to there's probably 4 or 5 vendors across the country that can license this type of data from, but it's not inexpensive. Any other questions? All right. Thank you very much. I appreciate the opportunity.